One of the common measurements in clinical medicine is blood pressure, and the standard method is still that developed by Korotkoff in 1905. However, it is susceptible to numerous errors, so an understanding of the technique and a strict routine are essential. The pressure is measured by connecting an inflatable cuff round the arm to a mercury column, and the apparatus is called a sphygmomanometer. The Korotkoff heart sounds are heard through a stethoscope. Either radial or brachial pulse is palpated with the fingers and the cuff inflated until the pulse disappears. The stethoscope is placed over the brachial artery, and as the cuff pressure is lowered, beats are heard corresponding to the pumping heart. This point indicates the systolic pressure. As the cuff pressure is further reduced, the sounds eventually become muffled. This point is generally taken as the diastolic pressure. Strict routine is a necessity to achieve consistent results. The systolic and diastolic pressures are recorded on the patient's notes. In the heart, as the left ventricle contracts, the pressure rises to a peak of about 120 millimeters of mercury and then falls off sharply to about 100 millimeters at the end of the pumping stroke. The resting period while the left ventricular chamber is refilled with blood is diastole. The aorta is in continuity with the left ventricle, and its pressure also reaches 120 millimeters. But as the left ventricular pressure starts to fall and reaches about 100 millimeters, the aortic valve shuts. But elastic recoil of the aorta and arteries maintains a flow of blood to the tissues during diastole, and the blood pressure declines slowly. The pressure in the aorta has only fallen to 80 millimeters by the time the next pumping cycle, systole, occurs, and the pressure goes up again to 120 millimeters. The action is repeated. The maximum pressure in the aorta and the large arteries is called the systolic blood pressure, and the minimum, the diastolic pressure. The blood pressure for a patient contains both figures and is quoted, for example, as 120 over 80 millimeters of mercury. When blood is flowing through an artery, the flow is laminar. That is, the outer layers next to the vessel wall are flowing slowly compared to the stream in the center. This type of flow is silent on a stethoscope. But when the speed exceeds a certain value, eddy currents appear and the flow becomes turbulent. The vessel wall will now vibrate, and this will transmit sounds. When measuring blood pressure, the cuff on the arm obstructs flow in the artery and velocity increases. The blood flow then produces sounds audible with a stethoscope. This is the basis of the Korotkoff method. In practice, all the equipment should be ready before the patient attends. With a simple mercury manometer, the top of the column is open to the atmosphere. There is a valve so that the mercury cannot leak out. The air above the mercury reservoir is connected by tubing to the rubber bag. This is placed inside the cuff so that it can be secured evenly round the arm. A hand pump can raise the pressure in the bag above the pressure of blood in the artery and thus stop the blood flow. It has a leak valve to lower the pressure. When the patient arrives, a simple explanation should be given, and if this is the first time the pressure has been taken, mention made of the temporary discomfort when the cuff is inflated. Measurements made with the patient lying down are more reliable than when sitting. sleeve should be rolled away from the cuff, but must not, of course, be rolled tightly so that it causes an obstruction. The center of the bag will lie over the brachial artery, which can be found by palpation of the pulse. The stethoscope needs putting on with the earpieces downwards and forwards. Since the blood flow is laminar, no sound will be heard until the cuff has been inflated. The radial pulse is palpated at the wrist. When the cuff has been inflated to a point well beyond that at which the pulse disappears, the bell is placed over the brachial artery. The leak valve is slowly opened and the pressure falls. No sound is heard until the systolic pressure is reached. The sounds are often faint, necessitating a quiet room. As the pressure is allowed to descend, there is a point at which the sounds suddenly become muffled. This is the diastolic pressure. The measurement is repeated. For reliable measurement, the patient should be relaxed, so it is preferable not to take a reading immediately upon arrival, but to allow a short period of rest. The blood pressure fluctuates by as much as 10 millimeters in most people with breathing, and measurements should be recorded to the nearest 5 millimeters. To avoid human error, it is better to take readings without knowing the figures for previous estimates. In the measurement of blood pressure, a knowledge of the functioning of both the heart and the equipment will help to obtain accurate and reproducible results.